Hi everyone, I am Janice, a pharmacist from Kaisa Pharmacy, and today I'll be sharing to all of you about depression. So what is depression? Depression is also known as a major depressive disorder, otherwise known as MDD. It's a mood disorder that makes you feel constant sadness or also lack of interest in life. So most people feel sad or depressed at times. It can actually mean a normal reaction to loss or life's challenges, but when the feeling gets intense, where it includes constant sadness, feeling helpless, hopeless, and also worthless, that can actually last up to many days, up to months, that can keep you from living your life. So in this coincidence, in this situation, it can actually mean something more severe, and it may be something more than just sadness. So you may be diagnosed with clinical depression, which is a treatable medical condition. So next I'll be sharing to you about depression symptoms. So according to the DSM-5 manual doctors use to diagnose mental disorders, you have depression when you have 5 or more of these symptoms for more about 2 weeks. So your mood is depressed for most of the day. That's the first symptom. Second is that you constantly feel tired or you have lack of energy. Third, you feel worthless. Fourth, you're hopeless or pessimistic. 5, you have a hard time in focusing, remembering details and making decisions. 6, you have difficulty in sleeping or you sleep way too much almost every day. 7, you have no interest or pleasure in many activities nearly every day. And 8, you have the thought of death or suicide. So the 9th point is you may feel restless or slowed down. And the 10th final point is that you may feel loss or also a weight gain surge in your body weight. So next I'll be sharing to all of you about the causes of depression. So doctors haven't pinpointed the exact cause of depression just yet. They do think that it might be a combination of the following conditions, in which there can be abnormalities in the brain structure, which means people with depression often show this appears to be a physical difference in their brains from people who don't have depression. The next point is that there might be a difference in the brain chemistry. The chemicals in our brain are called neurotransmitters, which play an important role in your mood and also elevate your mood. When you have depression, it could be because these chemicals are not actually working the way they should be. The third point is there might be a difference or a disruption in our hormones. So when your hormone levels change, it could be due to pregnancy, postpartum issues, thyroid problems, menopause, or other reasons. So they can often set off depression. So the fourth point is that it can be caused by genetic abnormalities as well. So researchers haven't found yet the exact gene that might be responsible for depression, but you are most likely to have depression if you have someone from your family that actually has it. Okay, so next I'll be sharing to all of you about the types of depression. So there are 7 types of depression in general. The first type of depression is anxious distress. In situations where we tend to worry a lot about things that might happen, or also things that we are not able to control. So the second type of depression is called the mixed feature depression, in which there's a mixture between depression and mania. In often where we can see periods of high energy, excessive talking, also high self-esteem. So the third type of depression is atypical features, in which you can feel very good or happy about certain events. You might also feel hungrier, sleep a lot, or you are highly sensitive to rejection. So the fourth type of depression is psychotic features, in which you believe things that aren't true, or see or hear things. In this episode, we might feel that the patient is a bit more delusional, or also imagine things that might not be there. So the fifth type of depression is catatonia, in which you can't move or control your body normally, which means there can be times where you are still unresponsive, or you have uncontrollable movements or spasms. So the sixth type of depression is known as the peripartum depression, in which your symptoms begin during pregnancy or also immediately after giving birth. So the last but not least type of depression is called the seasonal pattern, so in which your symptoms can get worse with changes in season, especially the colder, darker months of the year. So now I'll be sharing to all of you about depression diagnosis. So in order to diagnose depression, your doctor will use several methods to conclude that you have a certain type of depression. So the first method is called the physical examination, in which the doctor will check your overall health to see if you might be dealing with, or are you experiencing any other health condition, and your physical state, in which have you been conflicting any self-harm or any sort of issues like that might be similar to what I've mentioned earlier. So the second depression diagnosis is lab tests, in which, for example, you might need some blood work done to see whether there is a balance of hormone levels in our body. So the third type of depression diagnosis is known as the psych evaluation, or also the psychiatric evaluation, in which your doctor will be interested in your mental health or also status, asking about your thoughts, feelings, and your behavioral patterns. So in this stage, there might be also a questionnaire given up to fill up and to see how you have been dealing with your current emotions. So last but not least, we have the Diagnostic and Statistical Manual of Mental Disorder, which is also known as the DSM-5. So in this, there will be a few criteria for depressions in this manual. So your doctor would have like a checklist to check if you are experiencing any of the symptoms against it, to see if you fit the standards of being diagnosed as a depression or a patient under depression. So next, I'll be talking to all of you about the depression treatment. So basically, in general, there are about 5 different types of depression treatment that I will be going through. The first is medication, of course. So when we have a patient with depression, often antidepressant medications, either single or in combination with other medications, can be initiated. So often when there are many types of antidepressants, we may have to do a trial and error, in which you may have to see several kinds before you actually find the one that works for you best. So you may need combination of 2 or different kinds of medication, in which your doctor may initiate. It might be a combination of mood stabilizers, antipsychotics or anti-anxiety medications, or even stimulant medications. So the next way is called the psychotherapy. In psychotherapy, we often have like a mental health care professional that the patient constantly visits in order to talk about your depression and other issues that can actually help to treat the symptoms as well. So different methods are available in this component, which includes cognitive behavioral therapy such as CBT, or even talk therapy, in which we will be confiding to our healthcare professionals. So the third depression treatment is known as the hospital or residential treatment, in which your depression is so severe that you're having troubles to take care of yourself, in which you may have self-harm yourself or others that can actually live with you. So in this condition, we often need to refer the patient to the psychiatric treatment or a hospital or residential facility, in which they can be cared for even better. Last but not least, we have the electroconvulsive therapy, or otherwise known as ECT, for the treatment of depression, in which all oral medications do not work for you. This is such a case where the brain is stimulated through a therapy where electric currents are passed through your brain to help the neurotransmitters work better.